So how's your day going?
The best ever, and I am living it up, and I hope you are too.
Absolutely. That's why we are here to teach other people how to live it up. So specifically, we're looking for you to call and talk about your musculoskeletal pain. That means muscle pain, joint pain, ligament pain, back pain, neck pain. Perhaps you have arthritis pain or hip pain, etc. So all hour long, you can reach us at 866-870-5752. That's 866-870-5752. I'm going to suggest that you call right now because last time we had like 5 people on hold and the show had to end. It's only an hour show, folks, so get your calls in now if you want to speak to Dr. Darrow about your pain. It's really important. And you can also go to the website, which is www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site, and you can also see him performing the treatments on video. And when you phone in today, you get a free book, Dr. Darrow's latest. It is called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. It's got about 264 actual studies, research on this treatment. So it is for real. Trust me, I had the treatment. So again, our number is 866-870-5752. We are here Saturdays at 10 a.m. and at 1 p.m., and we'd love to hear from you. So...
Yes, I do.
I knew you had an email or a question there.
All right, so this one's cool. It mentions 2 body parts. That's why I'm bringing this up at once, because people often, when they come in and we fix, let's say, arthritis in the knee, they go, it's too bad you don't work on necks or you don't work on toes. And I go, I work on the whole body. The process is similar. It doesn't matter which part of the body it is, as long as it's for the musculoskeletal system. I don't work on cancer and multiple sclerosis and things of that nature, different diseases. If you have bad eyes, if you have eyesight that's failing, or you have macular degeneration, I don't do that. I do orthopedics. But at any rate, this person said, I have bad knee that is getting worse day by day as I try to walk. Also have some issues with my back. 3 discs slightly bulging into my nerve, causing pain, but it is not constant. I'd like to come in for an appointment evaluation. I've been listening to Dr. Darrow for many years on his radio program, and I'm amazed of his vast knowledge of the human body. Well, doctors are trained in just about everything, but we try to focus on one thing, and the thing I work on is the musculoskeletal system, although I have studied many other parts of the medical system inside of us, obviously. We have to know it all. But thank you for the kudos there. So we work on knees all day long. It's probably the most common thing we see. They say the knees go first, and I tend to agree with that. But about 80% of people also end up with back pain at some point. So there's a little misnomer here about this person saying they have 3 discs that are causing pain. Just because you have a bulging disc doesn't mean you have pain. Even a herniated disc doesn't mean you have pain. So be careful not to have a surgery for something you don't need it for. And that is sort of my life work, which is keeping people away from surgery when they don't need it. I love surgeons. They have difficult work to do, but unfortunately our culture in medicine is to operate too quickly when we don't need it, and to operate on things that we don't need operated on. Most of the patients I see never needed surgery, even though if they've had it and it's failed. The reason it failed is they didn't need it. It wasn't going after what I call the pain generator. What is the pain generator? We often don't know. So we'll look at an MRI and we'll see a herniated disc, or in a knee we'll see a meniscal tear or something of that nature. And the surgeons think we have to operate on it. And the byline of my life is take the surgery out of pain. That means we don't want to operate just because there is pain or because an imaging study shows something that is incorrect. So, in the knee we have a lot. Anita, I hear you breathing.
Yes, I always like to breathe to let you know we have a caller.
All right. Well, we can talk to Richard if you like.
But I can stop breathing. I can stop. It's not a big deal.
No, it's good. It's a very subtle intuition I have. So yeah, let's go to Richard. And Richard, you're in Casa de Casa. Your doctor said you need a hip transplant. How long has your hip bothered you?
About 5 months ago, I went to the doctor, and he said I needed a hip transplant. I had pain at the time. He took an x-ray, and then after that x-ray, he said that I needed a hip transplant.
Okay. So it's not exactly a transplant, but it's using a prosthesis, which is metal and plastic possibly, to replace the head of your femur, and the femur is the thigh bone that goes into the pelvis, and that part of the pelvis that can be augmented is called the acetabulum. So I don't like those surgeries. I have people coming all the time where they've had those replacements done and the prostheses installed, and the people come out worse. And they're sitting there crying in my office going, the doctor told me this is going to work, and now I'm much worse. What do I do? At that point, there's usually nothing I can do, because the work that I do is biologic. Biologic means I use cells either from your body, like your platelets from your blood, or we can take your bone marrow and use that, which has stem cells and platelets in it, to regrow the tissue in your hip or any other part of the body and get rid of the pain that way. So I'd be very leery about that. Just because an x-ray shows arthritis doesn't mean that you need to have surgery of any type, let alone a joint replacement. And the replacements I don't like at all. They wear out, and once it wears out the bone, and then what do? Put in a bigger prosthesis that can crack whatever bone is left. And I've told this story many times on the radio. I've been doing this radio show for about 20 years. And when I was back in Denver doing my internship doing orthopedic surgery, we had to replace an entire femur bone. That's the entire thigh bone had to be cut out. And we took a cadaver bone and we shaped it and placed it into the pelvis of a person. And I was not on that rotation long enough to find out if the work we did worked or not, but what's the chance that you put in a cadaver bone and it's going to live? Very, very minimal chance. So I don't like these surgeries. They're very invasive. It's very tough to go through. So I would have you look at my website, which is www.lastemcells.com, lastemcells.com, and you can watch videos of me injecting a hip. I use ultrasound guidance so I can see where that needle is going inside the body. And if you'd like to call the office now or any time to see if we take your insurance, that number is 800-300-9300, 800-300-9300. There are people by the phones right now. We do take Medicare, Cigna, Aetna, Blue Cross, Blue Shield, United Healthcare, and for people without insurance, we take Care Credit. We can help you get a credit card to help pay for medical procedures. Now the problem is that although we take insurance, it doesn't cover most of these procedures. It'll cover usually your first visit, and sometimes it'll cover ultrasound and other things. So you have to be wary about the costs involved in this too. So, Richard, what else do you want to tell us?
Well, Dr. Darrow, I understand there's different kinds of stem cells, and I'm 70 years old, and after reading about stem cells on the internet, I heard that bone marrow is not the best alternative for me as far as the type of stem cells I should be getting.
There's a lot of controversy right now because everybody has financial gain, and finances run, unfortunately, money runs this planet. So there are people that only do bone marrow and they badmouth everything else. And there are people like chiropractors that can't find a doctor to do bone marrow, so they buy cord blood stem cells off the shelf, and then they hire a doctor that doesn't know how to inject. Or even worse, they'll hire a nurse practitioner or a nurse to do it, and none of these people even know how to inject properly. Most of them don't use an ultrasound to guide the needle. In my experience, and we're doing a giant study right now, the results and the statistics show that you can use bone marrow or you can use cord blood stem cells, and the results come out equally well. Now, you'll hear the chiropractors who are selling this stuff say that the bone marrow is no good if you're 70 because your stem cells are old. That's nonsense. I've done this on people up to 100 years old. I'm 70 years old. I've done cord blood stem cells on both my knees and both my shoulders with amazing success. But if you talk to the guys that only use bone marrow, they're going to say I'm a liar. So there's a lot of controversy out there. I do the most of anybody, I think, on the planet. I don't know, that's what I've been told. When I go to national meetings and people hear how many I do a day, they can't believe it. I've done mega thousands of bone marrow, and I only started using the cord blood at the end of last year, so I'm only up to maybe 400 of those right now. But I'm doing about 100 stem cells a month, and I think my experience is better than anybody else's. Maybe it's not, I don't know. But we have a 20-person research team in my office, and the studies are showing that this stuff is amazing, and it doesn't matter which way you do it, it's all amazing work. Any more questions, Richard?
No, that should do it. Thank you very much, Dr. Darrow.
God bless
Thank
you,
you,
my
Richard.
friend. And the phone number to call us right now, because you're going to lose out if you wait, because it's going to be the end of the show and we won't be able to talk to you. But our number here at the station is 866-870-5752. I'll repeat it. Grab your pencil. 866-870-5752. I love your phone calls. We love our callers. And I want to mention a couple things before you start talking, Nita. One is we do vampire facelifts in the office, which is using the same cells to grow back the collagen in the face and make you pretty. And those results are amazing. I don't do those. I stick to orthopedics. But my wife is a nurse practitioner, and she's gorgeous. She works on her own face, believe it or not. And she is a nurse practitioner, and she does the vampire facelift, and she also does hair growth. So she injects the head to stimulate growth of the hair. I know people think that's weird, but this book that I wrote has research on it and shows that it does work. You get a free copy of the book if you come to my website. I can send you an e-copy of it, and you go to www.lastemcells.com, and I will shoot you back an e-book, or if you ask for it, I'll send you a free copy of Stem Cell and Platelet Therapy. The byline is regenerate, don't operate. There are hundreds of studies in this book showing that surgery is not the way to go, and that regenerative medicine is taking over the field of orthopedics. So be careful. Don't operate if you don't have to. If it's an emergency, go do it. But most of these cases that we see that fail, weren't emergencies to begin with, and the surgery never should have been done.
Well, that says a lot. Shall we go to Jamie and Silmar?
Yes! Jamie, Dr. Marc Darrow, how are you today?
I'm good. How are you doing?
I'm living it up. And you asked if stem cells help people with multiple sclerosis, MS. The answer is yes and no. So I'm going to tell you the yes part. The yes part is that when you inject stem cells IV, they work as a great anti-inflammatory. And MS is an autoimmune disease that creates inflammation in the body and creates plaques in the spinal cord and the brain. So people that get these stem cells feel better. But the part that is unfortunate is I don't know anyone that's healed from it. It could be. I don't do that work. As I was just telling Richard about, I do orthopedics, not neurological work. But if you want to go to the website, you can email me from every page there, and I will give you information on who to go see. I know docs who do this IV. I don't think the FDA likes it, but there are people that do it and get great results with it. I don't do IV. Someday I hope the FDA okays it. By October in 2020, we are supposedly going to have guidelines from the FDA telling us specifically what we can and can't do. Right now, we have a couple of criteria that are not that definitive. And I try to stay clear of the FDA and do things the right way and keep my license. I have 3 girls in college at one time. So I have a long career ahead of me, I hope. So I stick...
I really appreciate it.
Yeah.
I really appreciate it. I have several people in my family with MS, even though they say it's not hereditary. So,
Well, I agree with you on that. I've seen many families with multiple MS patients in that family. And, that makes you think it's got to be in the genetics some way.
yes. Well, thank you so much for the help. Anything I can find out is wonderful.
Yeah, just
so
go to my website and email me there. I'll give you more information. That's www.lastemcells.com. So let me ask you a question. Do you have any pain in your body?
Occasionally. I'm not too bad off. I'm 58 and I'm overweight, so I think that's part of a huge part of it. So
Okay.
I'm working on that, and then I'll go from there.
So Jamie, I do want to talk to you about overweight because are you open enough to talk about how much extra weight you carry? You don't have to if you don't want to.
Oh, sure. I'm probably about 280,
Okay.
and I'm 5'6", so I'm probably about 130 pounds overweight, maybe.
Okay, so let's just pretend...
A whole extra person with me.
No, that's okay. Let's just pretend that you're 130 pounds excess. Now, if we times that by 4, we're going to come out with, 520 pounds of pressure on your knees extra. Now, what do you think that's doing to your knees right now every time you stand
I
up?
know. It's the one of them is starting to be achy.
Okay.
It's gotten a little better in the last couple of weeks, but
Okay.
I understand. I've heard you before.
Oh, good.
And I was shocked. Yeah, I've heard you many times. I listened to you, and I was shocked at how much weight.
Yeah, biomechanically, every pound extra is about 4 pounds extra on the knee. So you're setting yourself up to live in a wheelchair because your knees are going to be arthritic over time. Not necessarily is this a promise, thank goodness, but the studies show that the excess weight causes arthritis in the knees. So, if you want to keep your feet working and your ankles and your toes and your knees and your hips, we would love for you to lose weight. We have a method in the office called Ideal Protein. It's not a high protein diet. It's eating the proper amount of protein and fat and carbs. What we do is we do lower the carbs and put people in ketosis. And we hear about the keto diet. Well, I've always been on a keto diet. I just grew up on that. It's what I've always chosen, basically protein and vegetables and water. And I'm about 166 pounds today, and I'm about 6 feet tall. So people say I'm skinny, and why am I skinny? Because it's healthier. My insulin is very low. My hemoglobin A1C, the last time I checked it, was 5.4. And I do that on purpose. I want to be able to move fluently. After the show today, I'm going to go out and play golf. I am a follower of what I teach on this show and what I teach my patients. I've used platelets and stem cells on my knees and my shoulders, my wrist, my elbows. I've had other people do my neck and back. I'm a very active person, and I want to stay that way. And it's very funny, at my dog park, which is close to my house, and I see it when I drive up the hill to my house. I live in the mountains. So the dog park has a bar that I can do chin-ups on, and it also has a track and other equipment.
Wow.
So I was coming home last night, and it was dark out, and it was kind of windy and cool, and I said, I don't want to stop there. I want to go home and eat. Well, guess what I did? I lurched over, I lurched over and drove into the dog park, and I did 3 sets of 10 chin-ups with my feet, what we call piked in gymnastics, meaning up to my face. And you know, it was dark. There might have been some coyotes or mountain lions lurking. And I did them fast. And I got in the car and I was like, I am so glad I did that. And I pushed myself.
Wonderful.
You know, going up the stairs in my house, I'm going to make sure I do at least 2 at a time. So I don't look at 70 as my age. I look at 16 as my age. And when
Amazing.
And you know, I keep that focus. I love Instagram because you can look up any subject you want. And what do I look up? I look up gymnastics. I was a gymnast when I was in high school and college. And I watch these things to know what I can do. I don't want to know what I can't do.
Right.
And it keeps my focus there. I still keep playing guitar. Why do I do that? You have any idea?
Well, it's a creative outlet.
It is. It's very relaxing. But
and to keep your hands limber.
Yes. And what other part of me?
Brain.
Your brain.
My brain.
Right.
So I'm not going down.
Yeah.
And I admire.
Well, that's inspiring.
Well, I'm saying all this. I'm not here to talk about myself. I could care less. But hang with us, because this is great for everybody to listen to.
Hold on, Jamie. We'll be right back after our break. You're listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil. Write down this important information about to come your way. I'm your host, Nita Valens, and we'll be right back.